Hello everyone and welcome to today's YouTube video. Today's YouTube video is about first aid of burns. So what is first aid? First aid is the first and immediate response given to a person who is suffering from a minor or a serious injury or illness in order to preserve life, prevent the condition from worsening, or to even promote recovery. First aid can be given by any person with the basic level of medical training. Now, what is a burn? A burn is an injury which is caused because of the following factors: heat, chemicals, electricity, etc. Now, before learning about the first aid for burns, we must know that there are 4 different kinds of burns. They are first degree burns, second degree burns, third degree burns, and fourth degree burns. Now, before providing any kind of first aid to the person, we must carefully look at the signs and determine what kind of burn it is. Now, let's start with first degree burns. A first degree burn, it usually affects only the epidermis or the outer layer of the skin. Hello Mrs. Sushil. I see that you were burned today. Please, will you show me where were you burned from? Okay, let me examine this. As we can see that the burn site is red, dry and with no blisters, with an increase in the skin color. It is a first degree burn. Now for the first aid, firstly immerse the burnt area in cool tap water. Secondly, apply cold wet compresses on the burnt area. Now, finally apply the petroleum jelly on the burnt area. Next are the second degree burns. So the second degree burns, they usually affect the epidermis and the dermis of the skin. Now the signs for second degree burns are usually blisters, the skin is moist or wet, there is a deep redness. Now for the first aid of second degree burns, we can immerse the burnt area for 10 to 15 minutes in cool running water. If it is not available, then we can also apply wet cold compresses. Using ice on the burnt area is not advised, as it will lower the body temperature and can cause further pain and damage. It is also mandatory to remove any kind of rings and ornaments around the burnt area, and we have to be quick and swift before the area or around the burn it swells. Also, it is advised not to break the blisters. Breaking the blisters can cause infections. Moving on to the third degree burns. The third degree burns usually are extended to the fat layer which is beneath the dermis, and it might appear stiff, waxy white or lathery and tan. The skin in case of third degree burns might turn into black, white, yellow or brown in color. Now in case of a third degree burn, we have to immediately call the 911 or the ambulance. Also, we have to prevent using any kind of ointments, butter or toothpaste on the burn, as it can cause infection. And we even have to make sure that we do not soak the burnt area in water, as it also can cause infection. The burnt area should not be covered by the burnt cloth, so we have to cut the burnt cloth. Elevate the burnt area above the hot level if it's possible to do that, and cover the person with a coat or a blanket. The last kind of burns are the fourth degree burns, which they are the most severe type of burns. The fourth degree burns, they usually include both the skin layer and the tissue lying underneath, probably also destroying the bone, the tissues and the nerve endings altogether. Usually there is no feeling in the area of the burn, because the nerve endings, they are destroyed because of the burn. The sign of a fourth degree burn is usually charred skin with probably exposed bone. A fourth degree burn is usually considered a medical emergency. An ER doctor in a hospital's burn unit will diagnose your burn and will treat you accordingly. We have to call 911 immediately. After that, if it is possible, we can raise the burned area above the heart level. And some of the don'ts in case of a fourth degree burn are that we should not in any case apply ice, ointments. We should not try to peel away the cloth that is stick to the skin of the burnt area, and we should not pick at or try to peel off the skin. Also, we can cover the person with a blanket or a thin sheet so that they may not feel cold due to the lowered blood pressure. I hope that the video turned out to be informative for everyone.